Myself, Dr. Shubada V.I, Vice Principal and Professor, Department of Shalya Tantra, Yenepoya Ayurveda Medical College and Hospital, Mangalore, discuss today a topic, Yogasana, a clinical intervention in upholding healthy GI system. Specific learning objectives of this session are: the learner should define healthy habits which lead to physical and mental well-being, should explain and relate postures of specific asanas which contribute to gut health. As we all know that the health is wealth. So, Ayurveda defines health as swastha. It defines samadhoshah samagnischa samadhatu malakriyaha prasannatmendriya manaha swastha itya vidhiyate. A person is considered as healthy if he has in equilibrium stages of his doshas. There are 3 doshas: Agni, digestion; Sapta dhatus, the tissues; and malakriyaha, excretory system; and of course a very healthy mind and sense organs. This is the definition given by Sushrutacharya 5000 years back in his treatise Sushruta Samhita, 14th chapter, Sutrasthana, 41st shloka. WHO defines health as: health is a state of complete physical, mental and social well-being, and not just merely the absence of disease or infirmity. What it tells? The health is very, very important. Nowadays era, there is urbanized lifestyles, hurry, curry and worry, status. The community is following a erratic lifestyle. The 3 pictures depict the same. It is about irregular food habits, stressful routines and sedentary lifestyles. These all 3 contribute disturbance in our body's functions, affecting various physiological functions including digestion, respiration, reproduction and endocrinal pathways. The very important ones I have highlighted here. There are so many disturbances in the body due to these setups. So, as I have mentioned, there are many functions which get disturbed by the unhealthy lifestyle. But in today's discussion, I will only concentrate on digestive disturbances which are incorporated from the cause. Digestive disturbances are presented from the patients like aversion to food, say no to food, he don't want to take the food, later the faces the consequences. If takes the food, in that situation of stress, there will be sore irritations, belching will be noticed, or there will be flatulence, gas in the stomach, what the patient will tell, and then lastly it will lead to constipation or the irritable bowel, one or the other they may land up in. There is a concept, gut-brain axis. It is a bidirectional communication network that links enteric and central nervous systems. There are hormones, neurotransmitters, immunological factors released from the gut are known to send signals to the brain either directly or via autonomic nerves. Clinical importance or the applications of this gut-brain axis is, we know that there are so many mental disorders like anxiety, depression and in autism spectrum disorders have well established researches and there are links to functional GI disruptions. Whereas some GI disorders like IBS often involves psychological comorbidities associated with alteration of the gut microbiome. So, it has been proved that there is a relation between gut and the mind, gut and the brain. So, how it is related? Even in way back 5000 years ago, Ayurveda also enlists some of the disorders like atisara. Atisara means diarrhea, which may be secondary to bhaya, that is a fear, an unknown fear. Shoka, that is very much grief it can lead to disturbance in the peristaltic movements of the GI tract, resulting into Atisara. Some of the jwaras, these are all the metabolic changes which is only accompanied by the mental features. So to overcome all these things, a very disciplined lifestyle has to be followed. One is the food, the first one, which is very important for the body, a well balanced food. Second is the proper sleep of 7 to 8 hours undisturbed, and third one is an exercise. So exercise may be in the form of asanas, may be in the form of asana with pranayama, or aerobics like walking 45 minutes till the one gets the sweating, jogging, skipping, or gyms, even Zumba dance, whatever may be the form of exercise, it should be followed regularly. So among that, the first one is food. Food that makes the body. Pranova annam, the prana or the jiva, life is anna. So we have to respect it, we have to give the time to it. So everything we are giving time for cooking, for preparing, for purchasing, but for the food intake, the people are not having time. So very important is to take the food in a very punctual manner. The same time, punctuality has to be maintained. First one, don't combine cold and warm food together. Like many are having the practice of taking an ice cream after dinner, after lunch. No, it is not comfortable for the digestive system. Eat the food half of your capacity so that the food will be easy to digest. And so there are the left hand side, these are the lists which show the relevance of good food in Ayurveda. The right hand side are the good food according to the dietitians. Old rice, Purana Shali, ghee, butter, buttermilk, green gram, pomegranate fruit, barley for the vegetarians. For the non-vegetarians, meat of goat is always praised. That means they can take any age people in any season. They can take these food without any extra advice. As per the dietitians, whole grains, leafy vegetables, lean proteins, low fructose fruits, yogurt, wheat, meat of goat are given as a first grade in the selection of the food. Next, moving for the exercise. Among the exercise today I am highlighting only asanas, that is yoga aspect. Asanas are having the importance as Bahiranga yogas because they influence various systems of the body, digestive, respiratory, reproductive, etc. So what do you mean by asanas? Asanas are hatasya prathamangatvam asanam purvam uchyate kuryat asanam stairyam arogyam cha angalaghavam. Angalaghavam means it brings the lightness to the body. One practices any form of asana or exercise. If you are practicing for 8 days, then 9th day if you are not doing, you feel the heaviness in the body. So that is the importance of exercise, regular exercise. Asanas are the specific body postures which are adopted and which should be retained for stipulated period of time and should be practiced slowly with the breathing. Regular practice of asanas will result in healthy state of the body. So I am concentrating in today's discussion some 5 to 6 asanas which are necessary for good GI system, gastrointestinal system. These are required because if the body takes the food, assimilates the food, uses the whatever food you have used, it is converted into blood, then only the body's personality, physique will be there and the person will be called as healthy. But today's discussion I am dealing only with benefits and how it acts for the healthy state. I am not discussing how to do the exercise. The yogasana should be learnt by an yoga instructor at least for a period of 1 to 3 months, and then it can be practiced your own at your home. That is very, very important. Posture is very important. Padmasana. The first one which helps in the GI system is Padmasana, called as lotus pose. In this posture, a person sits in a cross-legged posture, placing his or her feet on the opposite thigh. It benefits, improves digestion, relaxes mind, reduces muscular tension, helps in controlling blood pressure. So, before I will go for the next asana, each asana has to be performed minimum of 2 to 3 minutes if possible. 5 minutes if it is there in Padmasana, it is very good. The asana should be practiced empty stomach, or after food if you are doing, means 2 hours minimum gap should be there. Vajrasana is the only asana which can be done even after food intake. Within half an hour also it can be done. It is the only asana. The benefits are it aids in the digestion and helps in relieving the constipation. Strengthen the muscles of the pelvis and calf and thigh. Muscle exercise also it can fulfill. Dhanurasana, it is a bow posture, very difficult, slowly it will come. So, where lying on the stomach and lifting both the upper and lower body to resemble as a bow shape. The benefits are it stimulates abdominal organs and relieves constipation. It relieves mild backaches, fatigue, anxiety and menstrual discomfort also. It is very good. Paschimottanasana, it can be done both in the standing posture and sitting posture. Here for the digestion purpose, the sitting posture is there. So, it is a bending forward from hips without straining and grasping the feet of lower legs. It requires practice, half a month to 1 month if a person daily practices, so that this posture can be achieved. And the person who is having low backache, he can bend to his capacity. So, asanas or whatever asanas are there, to our capacity we have to do. We should not force the organs to bend or strain. Regularly if you are doing, it will come. The benefits: spine mobility, overall flexibility, it strengthens abdominal muscles, it relieves constipation and dyspepsia. Pavana Muktasana is also called as wind relieving pose. The name only indicates it helps to relieve constipation. IBS patients can do it, flatulence patients can do it. It helps in the maintaining the tone of abdominal muscles and pelvic muscles. Bhujangasana is known for females. It is very good asana for females who are having menstrual rhythm is not proper. So, Bhujangasana stretches the abdomen and strengthens the shoulder, arms and back muscles. It relieves or it removes the fat from the abdomen. It benefits are reduces the stress, improves the blood circulation. It regularizes the menstrual blood flow and frequency. It also is helpful in PCOD patients, polycystic ovarian disorder patients also. So, overall mode of action of these yogasanas on GI system are: asanas improve the blood flow of the intestines to prevent the constipation and bloating, and help with the management of IBS and gastroesophageal reflux disorders also. It increases the circulation and promotes gut motility and also decreases the stress. Padmasana in particular is known to improve the digestion by stimulating the release of enzymes to digest the food. Pavana Muktasana is very effective in increasing peristaltic movements. It gives the pressure on abdomen, releases any trapped gases in the intestine, and it also relieves the constipation. Bhujangasana improves blood flow and oxygenation to the digestive system and eliminates wastes more effectively. It is helpful in treating constipation and flatulence, the indigestion, so on. Paschimottanasana increases blood circulation above the navel. So, above the navel level, whatever blood circulation is improvement that can be done. Working capacity of various glands connected to the digestion process, like for example pancreas, gallbladder, liver, all are activated by this asana, and which aids to the digestive power and secretions. Some of the research references also opine that there are therapeutic effects of yoga and ability to increase the quality of life. They emphasize on the mental health, which may influence a very healthy mental status, influence the physical status. There are also that gut microbiota effect on mental health that we have discussed in the gut-brain axis. To sum up today's discussion, recent researches also supported gut health, gastrointestinal disease and mental well-being are all connected. Healthy lifestyle, regular practice of asanas and pranayamas and committed habit of balanced diet, I will add on a proper sleep, are essential for healthy long life. So do practice all these 3 pillars in your life. These are the references. Thank you.